Good evening, everyone, and thank you so much for joining us. My name is Congresswoman Lauren Underwood, and I'm from Illinois, and I'm a registered nurse. 5 years ago, my colleague and sister, Alma Adams, and I co-founded the Black Maternal Health Caucus. We are so delighted that you could be with us tonight to celebrate the fifth anniversary of the caucus during Black Maternal Health Week 2024. We've made huge progress during the last 5 years thanks to the leadership and determination of advocates like you. We have an incredible program for you tonight with exciting updates on federal policy on maternal health from some very special guests from the Biden-Harris administration. So let's dive right in. It is my honor to introduce Secretary Xavier Becerra. He is the 25th Secretary of the Department of Health and Human Services and the first Latino person to hold that office in our country's history. I'm so glad we had this chance to hear from him directly on the work of the Biden-Harris administration and how they're working with the Black Maternal Health Caucus to solve America's maternal health crisis. Welcome, Secretary Becerra.
Congresswoman Underwood, thank you so much for inviting me to join you, Congresswoman Adams, and all the folks who have made the Momnibus, the idea of maternal health and addressing maternal morbidity and mortality a reality. So thank you, Congresswoman Underwood, for giving me a chance to say a few words on behalf of an administration that really has taken this by the horns. I think from certainly, of course, the Vice President, who was a part of this caucus that really pushed forward the champion of maternal health, the Vice President of the United States, Kamala Harris, but certainly all the way to the top with President Biden. The commitment is there. The commitment is there not just in the work that we've done to establish a template and a platform for how this administration deals with maternal health, but it also has to be something that you see in our values. And in our values, that's usually reflected in our budget. And in the 2025 fiscal year budget that we're pushing for in the coming years, the president provides more than $360 million to address maternal morbidity and mortality specifically. But on top of that, the entire budget, when you take a look at it in all the different aspects, and most of that money is in the Department of Health and Human Services, more than $2 billion is dedicated to maternal health. That's not just values, that's a statement about where we intend to go. And so working with the members of Congress who have made this a priority, this administration intends to move the dial when it comes to the health of mommies and babies as they move forward, because we know that in America, there is no reason why a mother should perish before she gets to see her child grow up and thrive. A child should not perish because mommy doesn't have the correct access to the care that the baby needs. We know that this is an opportunity for us to show that in the richest country in the world, everyone can get good health care. I just want to mention two things that we hope you will join us in to make sure that families in America recognize the opportunities they have. The Medicaid program, we thought this was a special way to make sure we got to mommies and babies. And so today, the Medicaid program in this country makes sure that for any state that's willing to adopt a program, a woman and her baby can have up to 365 days of care after delivery. It used to be 60 days, but for every state that takes us up on this challenge, they can have Medicaid matching federal funds for 365 days of care for mother and baby. That is now something that 45 states throughout the country have adopted. We want your help to make sure the 5 remaining states get on board as well. And so we're going to continue that effort. We're going to continue an effort on behalf of our administration that deals with substance use and mental health issues, that we move forward with maternal mental health. And we have set up a hotline to make sure women in America can contact someone who can provide them with professional help when they're really, really stressed. And finally, I think it's important to note that we're making every effort to make sure that every woman in America has access to the health care that they need, regardless of where they are, regardless of the kind of care it is, including abortion care. We want to make sure that every woman should continue to have the right to access the care that she needs. So working with Congresswoman Underwood, Congresswoman Adams, and the entire team that's really behind maternal health, please know from President Biden on down, we want in, we want to be part of this. Thank you, Congresswoman Underwood, for letting me join you today. And let me now turn it over to the other person in that dynamic duo, Congresswoman Alma Adams.
Well, good
All
afternoon.
yours.
Thank you, and thank you, Secretary. Good evening. I am Congresswoman Alma Adams, and I represent the 12th Congressional District in North Carolina. And I do want to bring you greetings, first of all, on behalf of Speaker Mike Johnson, Minority Leader Hakeem Jeffries, the Congressional Black Caucus, and the more than 700,000 citizens residing in my district. I am really pleased to join you tonight for a stakeholder update for Black Maternal Health Week. Thank you, Secretary Becerra, for those remarks and for your outstanding leadership. This administration has shown an unprecedented level of commitment to addressing the Black maternal health crisis, and I couldn't be more grateful to have you, Mr. Secretary, as a partner in this fight. I also want to thank and acknowledge Senator Booker, Senator Warnock, and Senator Butler, Amy Gilbert, Senior Health Policy Advisor for the Office of the Vice President, and Dr. Dora Hughes, Acting Chief Medical Officer for CMS, and all of the organizations that advocate daily for equity in healthcare, and especially for Black mothers. And of course, I'm honored to join my partner in this effort, Congresswoman Lauren Underwood, who co-chairs the Black Maternal Health Caucus with me. And this year marks the 5th year anniversary of our caucus. Black Maternal Health Week was founded by the Black Mamas Matter Alliance 7 years ago, and it's now recognized nationally. During Black Maternal Health Week, a growing movement stands together to recognize maternal health disparities, but we all know the truth. Our nation is in a state of crisis, and we are one of only 13 countries in the world where the rate of maternal mortality is worse than it was 25 years ago. American women die in childbirth at a rate much higher than other wealthy nations, and Black women in America die in childbirth at 3 times the rate of white women. 80% of all pregnancy-related deaths in the United States are preventable. It transcends education levels, it transcends wealth and insurance status. It can happen to anyone. And one of the women that I often talk about is Kira Johnson, because Kira lost her life to the Black maternal health crisis, not because she was unhealthy, not because she was uninsured or unlucky, but because she was unheard. In 2016, she checked into a hospital with her husband to give birth to her second son, Langston. Kira was an entrepreneur, a world traveler, a mother of 1 healthy boy already, and a Black woman. As a Black woman, she did not make it out of that hospital alive. She died from hours of neglect and severe hemorrhaging nearly 12 hours after delivering Langston. Kira deserved better. Kira Johnson mattered. And this story hits close to home because it is so common in our community. So common, in fact, that I almost lost my daughter, Janelle, the same way. A physician overlooking my daughter's complaints of pain in her abdomen, not listening to her needs as a Black woman, and not trusting that she knew her own body. And their dismissal of her pain almost cost my daughter her life and the life of my granddaughter, who recently attended her senior prom. And this is one of the reasons why I am so committed to this cause, and why in 2019, I joined Congresswoman Lauren Underwood to launch a congressional bipartisan caucus focused on Black maternal health. And together we developed the Black Maternal Health Momnibus Act. And I created my signature bill in the Momnibus, the Kira Johnson Act, named for the young woman that I just spoke about. I worked with Charles Johnson, her husband, and the organization that he founded, For Kira for Moms, to create this legislation. And we took input from many different advocacy groups, making sure to include the voices of Black mothers and families and physicians, midwives, and doulas. The Kira Johnson Act gets at the core of this crisis because this act will fund grant programs that implement racial bias training in maternity care settings. It will provide funding for community-based organizations that support doulas and midwives and other perinatal health workers. It will address social determinants of health, like housing, transportation, and nutrition. And it will fund respectable maternity care programs in hospitals where pregnant and postpartum patients can report instances of racial bias to promote accountability. So it's important to me that we talk about bias in maternal care, because I believe that Cura's care team needed this training. And it's not only about preventing that 80% of Black maternal health deaths that we think are preventable. And in North Carolina, that number is 85.5%. It's also about improving the quality of care. And so the Momnibus as a whole is a coalition, a collection of 13 bills, and it provides a roadmap so that our healthcare systems will finally make Black maternal and infant health a priority. We've already passed one bill within the Momnibus, the Protecting Moms Who Served Act, which provides resources and specialized care for our pregnant and postpartum veterans. The Biden-Harris administration's policies also draw on many facets of the Momnibus Act that I've mentioned, including major investments in community-based organizations and HBCUs to train culturally competent maternal health professionals. And while this is good progress, there's still so much more to be done. And we will take this week to raise awareness and recommit to a world where maternal justice and equality are a reality for all mothers. And since introducing the first resolution, recognizing Black Maternal Health Week in 2018 and launching the Black Maternal Health Caucus in 2019, we have made great strides, especially now that we have the Biden-Harris administration so engaged in the fight. But all good work starts within coalitions and partners who are committed to doing what it takes to eliminate the disparities once and for all. Partners like you. So together, let's continue to mobilize our communities through gatherings like this to advocate for change at the federal level. And of course, all action done at the federal level must be met with action at the institutional and state level, in our hospitals, in our clinics, and in doctors' offices. It's a privilege to work alongside each of you to realize this vision of quality healthcare and thriving futures for our Black mothers and their children. I really thank you for your time and for your participation and for all that you do for our communities now and in the future. Because somebody did say that a community can only grow great when old men and old women plant trees under which they know they'll never sit. I now would like to turn it over to Administrator Carole Johnson, who is leading exciting work at HRSA. Carole?
Thank you so much, Congresswoman Adams, and thank you to you and Congresswoman Underwood, Secretary Becerra, my colleague Amy Gilbert from the Vice President's office, and all of you who joined tonight, who are in communities across the country doing the incredible work that's necessary to make the United States the safest place to have a baby. I am Carole Johnson. I'm the Administrator of the Health Resources and Services Administration. I'm delighted to be here tonight to wish a happy 5th anniversary to the Black Maternal Health Caucus and to really reflect on how much has been accomplished thanks to the incredible work of the Black Maternal Health Caucus leaders like Congresswoman Underwood, Congresswoman Adams. It is so clear what having women in leadership positions means and what it can deliver for the American people. I am, again, at the Health Resources and Services Administration. We're the part of the Department of Health and Human Services that leads the department's efforts on maternal and child health, on building and training the next generation of the healthcare workforce, on providing services in rural communities, and in supporting community health centers that provide healthcare services to 30 million people, regardless of their ability to pay, across the country. So we are well positioned to help in this fight, and you will see us then being part of the implementation agencies for so much of what the Congresswomen have laid out in the Momnibus and what we in the Biden-Harris administration have said is absolutely essential to tackling this crisis. Because the unacceptable disparities we see in health outcomes, particularly for Black and Indigenous women, are just things that we must tackle. The President, Vice President, and the Secretary has given us all of the support and direction to be able to do that. And so we across the Department of Health and Human Services are committed to this work. As the Secretary mentioned, one of those signature initiatives is making sure that Medicaid coverage is extended to 12 months postpartum, where before, as many of you know, it had often only been 60 days. Most states have taken up that option, not all, and we're continuing to work to get to all. But as you all know, because you're the community leaders who have made this work who have been committed to this work for so long. A Medicaid card, an insurance card, is only as good as having a high quality place to use those services. And that's where we at HRSA step in to be able to build those supports. And so I'm going to give you a very quick top 10 list of things that we have been doing in the Biden-Harris administration to commit to our shared goal of making this country the safest place to have a baby. And so in no particular order, in the Biden-Harris administration, we've doubled the federal investment in home visiting so that new moms get high touch support from nurses and social workers and parents as teachers in their home to be able to navigate the new opportunities and the new issues they're facing as pregnant and new moms. We've launched a new enhanced initiative to focus our Healthy Start program, which is our community-based organization program that helps support pregnant and new moms. Our new enhanced initiative focuses on social determinants of health to address the critical issues that the Congresswomen have raised with respect to transportation and food security and housing and all the things that make it possible to have a healthy pregnancy. We're training more midwives. We're training more community-based doulas. We know that it is important to have a healthcare provider who looks like you and is from your community and listens to you, as Congresswoman Adams says, and is your advocate in this process. And having more community-based doulas, having more nurse midwives are essential to that work. We've increased the loan repayment amounts for OBs and midwives to train in return for them practicing in high-need communities across the country and in rural communities. We will pay more of their medical student debt. And so that's our way to get more OBs into the communities that need them the most. We've expanded our investments in rural interventions to make sure that rural communities, which are facing critical needs as hospitals consolidate, so that we have labor and delivery services in rural communities. We've nearly doubled the number of states that participate in our maternal depression program so that there's more screening and treatment for maternal depression across the country. We have invested targeted resources to improve prenatal care in community health centers across the country. In many communities, in many historically underserved communities, this is where people get their primary care. And making sure that we have prenatal care that's culturally competent, that is from providers who look like you, who speak your language, is so critical to getting people connected to care early and getting the best possible health outcomes. Thanks to the help from the Black Maternal Health Caucus, we've launched our research network focused on maternal health, led by Morgan State, but focused on historically Black colleges and minority serving institutions around the country who are coming together to really step up and respond to the fact that for far too long, our research in this field has not taken into account the incredible disparities and differences when it comes to Black maternal health. And so we're focused on targeting the research and not just academic research, but practical interventions based on that new network. And we've launched our maternal mental health hotline, as the Secretary mentioned. The maternal mental health hotline phone number is 833-TLC-MAMA. We hope that you will visit HRSA.gov and use our widget and put it on your website so that people will know how to get to that number, that you'll order our magnets and posters and get the word out and get the message out about the fact that there is this 24-hour a day, 7 days a week, call or text safe place to have a conversation, to get the emotional support you need, because we know far too many women are facing maternal depression and other mental health conditions, and we can intervene. These are preventable. And finally, on our top 10 list, I would say, to the Secretary's point, our budget matters, and our budget going forward for fiscal year 25 includes new investments in things like making sure emergency rooms have the same OB preparedness that our labor and delivery rooms have, because many, particularly as hospital changes are happening around the country, more and more babies are being delivered in emergency rooms. We want ED docs to have that same preparedness, particularly in rural communities. We also are investing in more training for labor and delivery nurses, because we hear from hospitals that labor and delivery nurses are one of the reasons that we're seeing contraction in labor and delivery departments closing. So we need to invest more and protect what we have while we expand access so that everyone has equitable access to the best possible healthcare. And the way that we've been able to do this is with the leadership not of Secretary Becerra, but also, as he mentioned, the Vice President who helped craft the White House policy and the White House blueprint to address the maternal health crisis. So I'm really pleased to turn it over to my colleague, Amy Gilbert from the Vice President's office. She's the Senior Health Policy Advisor to the Vice President to say a few words. Over to you, Amy.
Thank you so much, Administrator Johnson. Thank you so much to the Black Maternal Health Caucus for inviting me to participate on this evening's call on behalf of the Office of the Vice President. It's such an honor to be working in this administration, thanks in part to the Robert Wood Johnson Foundation Health Policy Fellowship Program that brought me here. I want to say it's an honor to be joining this panel, an honor to be speaking with all of you. As I think you all know, or many of you know, Vice President Harris has spent her entire career fighting for the health, safety, and well-being of women, especially those who face disproportionate barriers to accessing the care and support they need and deserve. As senator, she joined forces with others on this call to bring racial disparities and maternal mortality to the forefront of the national conversation. She introduced resolutions to recognize Black Maternal Health Week and drew national attention to the Black maternal health crisis. She introduced legislation to address racial disparities in care settings in the workforce, including the Maternal Care Act in 2019. And a particular note, in 2020, she joined Representatives Adams and Underwood, along with other members of the Black Maternal Health Caucus, to introduce the landmark Black Maternal Health Omnibus Act. As Vice President, she's brought these priorities along with her to the White House. She hosted a roundtable on maternal health to coincide with the first ever presidential proclamation marking Black Maternal Health Week in 2021, and issued a nationwide call to action for federal agencies, businesses, and nonprofits to collaboratively solve the maternal health crisis, leading the first ever Maternal Health Day of Action. She hosted a maternal health cabinet meeting in April of 2022, requesting transformative agency commitments, and announced the White House Maternal Health Blueprint for addressing the maternal health crisis that June. This was a whole of government approach to combating maternal mortality and morbidity, and we're in year 2 of 5 years. There's quite a bit of notable progress to mark here, as Secretary Becerra, Administrator Johnson have already noted. Since the VP called on states to extend postpartum Medicaid coverage from 2 to 12 months in 2021, 45 states plus DC and the US Virgin Islands have done so, up from 3, to the benefit of millions of women and children across the country. HHS has helped more than 30,000 women and families since launching the Maternal Mental Health Hotline, which provides 24/7, 365 support. And we've helped diversify the perinatal workforce, with 12 states and DC now offering a Medicaid doula benefit. Vice President Harris strives to keep the crisis in the public eye. She's underscoring its importance through a pretty steady cadence of interviews and remarks focused on Black maternal health, and she consistently elevates the issue with national leaders and policymakers, convening state legislators, perinatal care professionals, private industry, and others to ensure all mothers can access the care they need and deserve before, during, and after childbirth. Thank you so much for listening. Again, it's a pleasure to be here with you. And I have the great pleasure of introducing Representative Lauren Underwood again, an important partner to the Vice President in this work and co-founder and co-chair of the Black Maternal Health Caucus.
Well, thank you so much, Amy. Thank you for being with us. And hello again, everybody. I am so excited to be able to give you this update. We were so fortunate to be able to be joined by Secretary Becerra, Co-Chair Alma Adams, Administrator Johnson, and as you just heard, Amy Gilbert. I'm so grateful that they took the time to be with us today. The Biden-Harris administration has been an incredible partner in our fight to solve our nation's maternal health crisis, and we are grateful for their leadership. 5 years ago last week, my sister and colleague, Congresswoman Alma Adams, and I launched the Black Maternal Health Caucus, and we were honored to be joined by then Senator Kamala Harris. And what a journey it's been since 2019. I'm so proud to have reached this milestone. See, when we first started the caucus, we thought it was just going to be us. We wanted to work on this issue, so we started a caucus and we gave ourselves a name, mostly because that's just how Congress works. But it turns out we weren't the only ones who cared about this issue, and we were completely blown away by the response. With 53 founding members, we created the Black Maternal Health Caucus to organize around the goals of elevating the Black maternal health crisis and advancing policy solutions to improve maternal health outcomes for all moms. And since then, our caucus has grown to be among the largest bipartisan caucuses on Capitol Hill. Moms across America are demanding a comprehensive solution to end our nation's maternal health crisis. So we looked at the data, we talked with the experts, we talked with community leaders, and we wrote a comprehensive solution, and it's called the Momnibus. Now, the Momnibus is our comprehensive package of 13 evidence-based bills that addresses every driver of maternal mortality, morbidity, and disparities in the United States. And when I say comprehensive, I mean comprehensive. It's designed to solve America's maternal health crisis. As a caucus, in just 5 years, we've made huge progress. We've enacted sweeping policy changes that are expanding access to high-quality maternal health care and providing robust support throughout the perinatal period. As you've heard, we passed the first Momnibus bill into law. It's called the Protecting Moms Who Served Act. And President Biden signed it into law in 2021, and we've already introduced the successor. It's called the Maternal Health for Veterans Act. Just last month, the House Veterans Affairs Committee held a hearing on that bill, and I was honored to testify in support. In 2019, we also knew that this crisis needed better research. So we met with Dr. Francis Collins at the National Institutes of Health, and we explained the problem, and he got it. And after the meeting, NIH pulled together separate funding streams into what's now called the IMPROVE Initiative. IMPROVE is an acronym, and it stands for Implementing a Maternal Health and Pregnancy Outcomes Vision for Everyone. And 5 years later, we've increased funding for IMPROVE fivefold. And this week, we are introducing bipartisan legislation to make IMPROVE permanent with Senator Laphonza Butler. Last year, for the first time ever, we also got funding for HBCUs and minority-serving institutions to study maternal health outcomes. And now that funding is rolling out to universities across the country. But that's not all. In the 2024 federal funding package that the president signed into law last month, you probably saw headlines talking about, crisis averted and there's no federal shutdown. That's what I'm talking about, that federal funding bill. We secured more than $100 million. Let me say that again, $100 million in funding for Momnibus priorities. And that's on top of the $100 million we secured last year. But friends, we still have a lot of work to do. We know that our maternal health crisis is getting worse, not better. And the one thing I really want you to know about this money, you have to apply for it. We've secured the money, okay? But now stakeholders, researchers, community-based organizations, state and local governments, y'all need to go and get this money, okay? Those dollars are for us, and we need those resources in order to be able to do the work. Please apply. After 5 years on working on this issue in Congress, I have never been more hopeful because we have a solution to this crisis. But we just need the bipartisan will to invest in these solutions and the people and the organizations that are doing this important work. This year, we have a unique opportunity to get it done. It's time for Congress to pass the Momnibus now. We have this unique legislative and political opportunity. Our moms can't wait. So I'm looking at all the leaders on this call, and I have never been more confident that we can do the work that's needed to save moms' lives, to end these disparities, and to provide every growing family with the care and support that they need and deserve during and after pregnancy. So thank you all so much for being here and for being part of this movement. Now, I'm so pleased to be able to introduce remarks from a few more of our partners. So you're going to hear from the following individuals. Senator Cory Booker from New Jersey, and Senator Booker is the lead Senate sponsor of the Momnibus. You're going to hear from Senator Raphael Warnock of Georgia. You'll hear from Senator Laphonza Butler from California. And then we are so honored to welcome Dr. Dora Hughes, the Acting Chief Medical Officer and Acting Director of the Center for Clinical Standards and Quality at CMS. Okay, thank you.
And happy Black Maternal Health Week. 7 years ago, the first Black Maternal Health Week was celebrated. And since then, this week has remained one dedicated to activism, building awareness, centering and amplifying the voices, expertise, and lived experiences of Black mamas. Today, we are also celebrating the 5th anniversary of the Black Maternal Health Caucus. In 2019, Representative Lauren Underwood and Representative Alma Adams, having seen the injustices in maternal health outcomes for Black women in the United States, came together and founded the Black Maternal Health Caucus to advance policy solutions that would improve maternal health outcomes and end disparities. I had the privilege and honor, really, of working with these two trailblazers for years now on the Black maternal health crisis in America, an issue that intersects with healthcare justice, racial justice, economic justice. And just 5 years since the inception of the Black Maternal Health Caucus, I'm really proud to see the profound progress that has been made in Congress and by the Biden administration. I'm talking about the Mom the Bus legislation that I had the honor of leading with Representative Underwood and Adams that would address every leading cause of maternal death in the United States and make critical investments to address social determinants of health and disparities in maternal health care outcomes and ensure that our healthcare system treats pregnant people with care and dignity regardless of their race or circumstances. This legislation has garnered the support of 193 House members, more than 200 organizations throughout our great nation, and a majority of the Senate Democrats. One of the bills in the Momnibus has already been signed into law by the president, but we need to get all of the Momnibus over the finish line. I'm also talking about the over $100 million for Black Maternal Health Caucus priorities that were signed into law as part of the fiscal year 2024 appropriations package. We're making progress, but we all know the goal has not yet been achieved. So in addition to our efforts in Congress, we got a president and a vice president who have maintained their commitment to prioritizing Black maternal health as the key issue in their administration. It is one of their top priorities. They have given states the option to provide a full year postpartum coverage to women on Medicaid, increasing it from just 60 days, a policy that I and others in Congress have long advocated for. This great president and vice president released a blueprint for addressing the maternal health crisis, which outlined actions that the federal government will take to combat maternal mortality and improve maternal health. This president and vice president launched the Maternal Mental Health Hotline so that 1 in 5 women in America who experience maternal mental health conditions can get the support they need. This is just to name a few of their initiatives. We are lucky. We've got a Congress and the CBC and some great Senate Democrats focused on these issues, and we got a president and vice president who are also focused. We're taking action, but we can't stop here. Right now, the United States has the highest maternal mortality rate of any high-income country, and alarmingly, the trend is not getting better, it's actually getting worse. And with the continued attacks on abortion care access, coupled with rising cases of criminalization due to pregnancy loss, a direct result of the Dobbs decision, this issue is more urgent now than ever. Here's what gives me hope. More than 80% of pregnancy-related deaths are preventable. We have the resources to save the lives of pregnant people and finally end this crisis. And the solution lies in continued, comprehensive, evidence-based federal action. We can do this. In the U.S., we should not be seeing headlines of the maternal mortality rate rising, Black women unable to afford basic prenatal care, women being criminalized for having miscarriages, and providers in fear of giving their patients the life-saving care that they need. These stories are an affront to the ideals of our country. All of you are gathered here today to understand, you all know this, that this is not an issue that is just one that is important. It is literally about life and death. I'm so grateful to be a part of this fight with you. I want to thank Representatives Lauren Underwood and Alma Adams for bringing us together today. This is where our power lies, in all of us working together. I want to celebrate what we've done, and I'm excited to be with you as you plan for the future. Congratulations on 5 years of the Black Maternal Health Caucus, and again, happy Black Maternal Health Week. Thank you.
Hello, advocates, stakeholders, supporters, and friends of the Black Maternal Health Caucus. And happy Black Maternal Week, everyone. Listen, it's great to gather, to take stock of all the progress we have made in strengthening the health of Black women throughout our communities. What could be more important? And while we have come a long way in understanding the data and identifying the overarching healthcare problems facing Black women, we still have much further to go. More than 80% of pregnancy-related deaths in the United States are preventable. And while stats like this are horrible and heart-wrenching, they also provide us with hope. Hope that we can make a difference. Hope and a burning desire to change this reality by recognizing maternal warning signs, providing timely treatment, and delivering respectful, quality care to all mothers. And I'm proud of my bipartisan work in the Senate to support efforts to better understand how we improve health outcomes for Black women. We can and we must continue this effort to protect the health of Black women, and I'm going to continue doing all I can at the federal level to ensure Black women and mothers have access to the quality care that they need. Thank you all again for everything you do, and happy Black Maternal Health Week. Keep the faith and keep looking up.
Congratulations, Black Maternal Health Caucus, on 5 years of advocacy and strength and fight and grit. Congresswomen Alma Adams and Lauren Underwood, we are so grateful for your tireless leadership to continue to give a place for Black women and the legislators who care about their overall health. To be a part of a collective focused on doing something about it. And as we prepare for Black Maternal Health Week, we truly have a lot of work and a lot of voices to do something about it. I am excited to join my colleagues, Senator Booker and Senator Warnock, in the Senate to make sure that we are lifting up our voices and using our platforms to advance the work of passing the Momnibus in the Senate and making sure that Black women all across this country know that there are leaders in Washington, D.C., that this is a caucus that is bicameral and focused on making sure that Black women's health is highlighted and our demands and call for action is heard. And I want to thank Congresswoman Underwood for inviting me to be a part of another effort to raise our voice and to make sure that the issues and challenges of Black women actually get the funding that they need. I am excited to be introducing the NIH Improve Act on the Senate side, making sure that there are resources that are dedicated, consistent funding that is directed to the research that is so critical to finding truly the root causes of the maternal health crisis and making sure that our cause has the funding necessary to find those answers and be another place where the true expression of health for women is being manifest in our federal policies. And so thank you to all of you who are a part of this broad national team lifting your voices for Black women's health and for the health of women all over our country. I'm excited to be a part of it, and I'm excited to join you for Black Maternal Health Week. Thank you so much.
Congresswoman Underwood and Congresswoman Adams, thank you for inviting me to participate in this call. I am Dr. Dora Hughes, the Director of the Center for Clinical Standards and Quality, or CCSQ, at the Centers for Medicare and Medicaid Services, or CMS. CCSQ is primarily responsible for implementing all national clinical quality and safety standards for healthcare facilities and providers, as well as establishing coverage determinations for items and services that improve health outcomes for enrollees. Working to ensure that all women have access to high-quality maternity care is a top priority for all of us here at CMS. The Medicaid program covers more than 40% of births nationwide, and more than 65% of births to Black mothers. As our administrator, Chiquita Brooks-LaSure, likes to say, the health of our nation really does begin with the health of our mothers and children. Unfortunately, the United States is facing a worsening maternal health crisis, and it's especially the systemic disparities in the healthcare system that have led to it. Regardless of income or education level, Black women are 3 times as likely to die from pregnancy-related complications. Overall, recent evidence suggests that 2 out of 3 pregnancy-related deaths in this country are preventable. In response to this tragedy, in June of 2022, the Biden-Harris administration launched the White House Blueprint for addressing the maternal health crisis, with Vice President Harris leading the effort to bring the whole of government to bear on this crisis through a sustained multi-year, multi-agency effort to combat maternal mortality and morbidity and reduce racial disparities nationwide. CMS is doing our part. We are attacking the maternal health crisis with a holistic approach. Our Maternity Care Action Plan is working across CMS to improve health outcomes and reduce inequities for people during pregnancy, childbirth, and the postpartum period. Among our efforts, one that I will mention is our Birthing Friendly designation. It's an icon on CMS's Care Compare online tool that helps consumers to identify hospitals and health systems that have demonstrated a commitment to maternity care quality. As a second mention, I would note that CMS can now offer an option to help states provide 12 months of continuous postpartum coverage through their Medicaid programs, up from only 60 days. 45 states, DC, and the Virgin Islands have expanded coverage through this option. This postpartum coverage helps ensure that new mothers can access critical physical and mental health care during the postpartum period. As a third mention, the CMS Innovation Center recently announced the Transforming Maternal Health model, which is designed to support state Medicaid agencies develop and implement comprehensive approaches to pregnancy, childbirth, and postpartum care. Through our models and other CMS programs, CMS is working to build connections between medical care and social supports as well. For example, CMS has created a screening tool for health-related social needs to determine what, if any, additional supports mothers may need for health-related social needs, mental health, or substance use disorder. And apart from CMS Innovation Center models, CMS has also begun to require hospitals through its Hospital Inpatient Quality Reporting Program to report data on the screening of patients for certain health-related social needs like food insecurity, housing instability, transportation needs, difficulty with utilities, and interpersonal safety. And finally, I would note CMS is also exploring opportunities to expand and improve access to a diverse maternity care workforce, including midwives, doulas, and community health workers. At CMS, we plan to continue to use every available lever to support people during pregnancy, childbirth, and the postpartum period, and to advance health equity across our country. Thank you again for inviting CMS to participate in this important call.
So, as we wrap up today's call, I want to thank our speakers and each and every one of the guests who joined us tonight. 5 years in, we've come so far, but there's still so much more work to do, and we can't do that work without your help. So please speak up, share your stories, make your voices heard, and demand the change that our moms deserve. Now, I also hope that we'll continue to stay connected. So you can follow us on Twitter at BMH Caucus. Again, that's at BMH Caucus. You can also check out the Black Maternal Health Caucus website, and you can sign up for our new newsletter called the Momnibus Memo. And of course, you can always email us at blackmaternalhealthcaucus@mail.house.gov. I look forward to speaking with you again soon. Thank you so much for joining us tonight, everybody, and take good care.